Hello, I'm Rob Hamilton, the owner and clinician at Hearing Well Matters. In this video, I'd like to discuss the condition known as tinnitus or ringing in the brain. But before I do, a little ear humor. A man goes to see his physician because he has some lettuce sticking out of his left ear. The doctor examines him, and you know what he says? That's just the tip of the iceberg. Tinnitus is defined as the involuntary internal sensation of sound, which is audible to the patient when no external sound exists. It's been described as ringing, but it can also present as clicking or humming. It's very common. Almost 40% of Canadians, over 9 million, report having experienced tinnitus, and about 1.5 million reported as having been bothersome. Tinnitus can cause sleep disruption, cognitive and concentration problems, as well as stress. There are a number of potential causes for tinnitus, including hearing loss, excessive buildup of earwax, certain medical conditions or drugs, as well as stress and anxiety can all be factors in tinnitus. There are no cures for tinnitus, but there are good treatments. And the treatments involve trying to break the vicious cycle of tinnitus. By the vicious cycle, we mean that tinnitus might appear initially to a patient. The patient gets an increased awareness of it. That sets in a negative reaction for the patient, which draws more attention to the tinnitus to the point where it's perceived as being chronic. And that's when the patient usually needs it to be managed. Treatments involve tinnitus evaluation, including a patient history, a pitch and volume matching to better understand what tone and volume the tinnitus occurs at, as well as some questionnaires to understand how bothersome the tinnitus is to the patient. Treatments follow two broad lines. The first one is called tinnitus retraining therapy, which is a cognitive behavioral approach in order to get the patient to better understand and control the tinnitus. And a second path of treatment is called sound therapy, which uses sound to teach the brain to reclassify the tinnitus as unimportant. Many patients get benefit from their tinnitus with hearing aids, as well as changing their lifestyle in terms of their diet or alcohol and tobacco intake, or increasing their relaxation. If you think you suffer tinnitus and you would like to discuss an evaluation, please call us at Hearing Well Matters at 905-681-4327 or send us a message at info@hearingwellmatters.ca. Thank you.